Hello all, I'll be discussing REITER'S syndrome in this video. Welcome back to my channel. This is Dr. Meghna. Must know syndromes in dentistry part 19. Reactive arthritis or REITER'S syndrome. The classic triad of reactive arthritis include conjunctivitis, which means eye inflammation. The second is arthritis, which means joint is inflamed. The third is urethritis. It is the inflammation in the urinary system, mostly the urethra. It's a rare type of autoimmune response to a bacterial infection somewhere in your body, like urinary tract infection, sexually transmitted infection, gastrointestinal infection such as food poisoning, or maybe a throat infection like sore throat. Your immune system reacts with inflammation in your joints, eyes, skin, or other tissues. These symptoms typically last for several months. REITER'S syndrome begins several days to weeks after the original infection ends, and only in a small percentage of people it appears that the infection triggers an autoimmune response. This means your immune system overcorrects and begins to target healthy parts of your own body with inflammation. Fortunately, unlike most autoimmune diseases, reactive arthritis or REITER'S syndrome is usually a temporary condition. It's seen in association with geographic tongue or the wandering rash of tongue. It has a predilection for males. It mostly affects males under 40 years of age. It is also common in individuals with HIV or other immunocompromised states. Next is autoimmune disease. Also, there is increased predilection for patients who have HLA-B27 gene. Diagnosis depends on clinical features and physical examination, radiography and genetic tests in some cases. Let's see the treatment of reactive arthritis. This includes antibiotics. Depending on the infection that started it and whether it's still active, sometimes a course of antibiotics like doxycycline and rifampin can stop or shorten the reactive arthritis. The second is NSAIDs. A temporary high dose of a potent non-steroidal anti-inflammatory drug like indomethacin can be given. After reducing your symptoms, they'll reduce the dose. The next is DMARDs. This is modifying anti-rheumatic drugs like sulfasalazine. This treats inflammatory arthritis by suppressing some of your immune system's activity. They can help if NSAIDs aren't working. The next is corticosteroids. Most people with REITER'S syndrome don't benefit from oral steroids. These anti-inflammatory drugs can be useful as topical creams or as an injection into the joint space. Hope this is clear. You can note the entire chart in this format or you can take a screenshot of it. For such content, subscribe to my channel.